Paracetamol is a common pain reliever. It is also known as acetaminophen. Many people use paracetamol. They use it for headaches, muscle aches, and fever. It is important to use paracetamol safely. This essay will teach you about paracetamol. You will learn about its uses. You will learn about its dosages, and you will learn about its safety. It is important to understand paracetamol. This knowledge will help you use it safely. It will also help you feel better when you are sick.
Paracetamol is a pain reliever. But how does it work? Paracetamol blocks chemicals in the brain. These chemicals are called prostaglandins. Prostaglandins cause pain and fever. When you take paracetamol, it reduces prostaglandins. This eases your pain. This also lowers your fever. Paracetamol does not reduce swelling like some other pain relievers. Paracetamol works quickly. You may feel relief in as little as 30 minutes. It is important to note that paracetamol treats symptoms. It does not cure the underlying cause of your pain or fever.
Paracetamol is very versatile. It can treat many common ailments. People use it for headaches. They use it for muscle aches, and they use it for fever. Paracetamol is effective for mild to moderate pain. It can help with toothaches, it can help with back pain, and it can help with menstrual cramps. Paracetamol is safe for most people when used correctly. Always follow the instructions on the label. If you have any questions, ask your doctor or pharmacist.
Taking the correct dose of paracetamol is crucial. Too much paracetamol can be harmful. The dosage depends on your age. It also depends on the form of paracetamol you are taking. For adults, the usual dose is 500 milligrams to 1 gram. You can take this every 4 to 6 hours. Do not exceed 4 grams in 24 hours. For children, the dosage is weight-based. Always use the measuring device that comes with the medication. Never guess the dose.
Section 5. Measuring made easy. Accurate dosing for liquid paracetamol. Liquid paracetamol is often used for children. It is important to measure it correctly. Use the measuring device that comes with the medicine. First, shake the bottle well. Then, draw up the liquid to the correct dose mark. Check the dose carefully. Make sure the bottom of the meniscus lines up with the dose mark. Never use a household spoon to measure liquid medicine. Household spoons are not accurate. This can lead to accidental overdose.
Section 6. Potential side effects. Recognizing and managing risks. Paracetamol is safe for most people. However, like all medications, it can cause side effects. Most side effects are mild. They often go away on their own. Common side effects include nausea and stomach upset. Some people experience allergic reactions. Symptoms include rash, itching, and swelling. Serious side effects are rare. They are more likely with high doses. If you experience severe side effects, seek medical attention immediately. Section 7. Paracetamol and your liver. Understanding the importance of safe use. Paracetamol is processed by the liver. Taking too much paracetamol can damage the liver. This is why it is important to follow dosage guidelines. Never exceed the recommended dose. People with liver problems are at increased risk. They should talk to their doctor. Their doctor may recommend a lower dose. If you experience signs of liver damage, seek medical attention. Symptoms include yellowing of the skin or eyes, dark urine, and abdominal pain. Section 8. Interactions to watch out for combining medications. Safely, paracetamol can interact with other medications. This means that one medication can affect how the other works. Always tell your doctor about all the medications you take. This includes prescription drugs, over-the-counter drugs, and herbal supplements. Some medications can increase the risk of side effects. For example, taking paracetamol with blood thinners can increase the risk of bleeding. Your doctor or pharmacist can advise you on safe medication use. They can help you avoid potentially harmful interactions. It's important to understand that even common medications can have serious interactions. For instance, Combining paracetamol with certain antidepressants can lead to increased side effects such as dizziness or drowsiness. Additionally, some over-the-counter cold and flu medications also contain paracetamol, which can lead to an accidental overdose if not monitored carefully. Always read the labels and packaging of any medication you are taking. If you are unsure about any potential interactions, consult with your healthcare provider. They can provide personalized advice based on your medical history and current medication regimen. Remember, safe medication use is not just about taking the right dose, but also about understanding how different drugs can interact with each other. By being proactive and informed, you can significantly reduce the risk of adverse effects and ensure that your medications work effectively. Section 9. Paracetamol and alcohol. A dangerous mix. Alcohol can increase the risk of liver damage from paracetamol. This is because both substances are processed by the liver. When taken together, they can put a strain on the liver. Avoid drinking alcohol while taking paracetamol. If you do drink, do so in moderation. Limit your alcohol intake to the recommended guidelines. If you have any concerns about alcohol use, talk to your doctor. They can provide support and guidance on reducing your alcohol intake.
Section 10. Safety first. Practical tips for using paracetamol responsibly. Here are some practical tips for using paracetamol safely. Always read the label before taking paracetamol. The label provides crucial information about the correct dosage and any potential side effects. Follow the dosage instructions carefully to avoid any risk of overdose or underdose. Use a proper measuring device to measure liquid paracetamol. Never use a household spoon, as it may not provide an accurate measurement. A medical measuring spoon or cup ensures you take the correct amount. Do not take paracetamol for more than 10 days, 5 days in children, unless directed by a doctor. Prolonged use without medical supervision can lead to serious health issues, including liver damage. Store paracetamol out of reach of children. Medications can be harmful if ingested accidentally by children, so always keep them in a secure place. Tell your doctor about all the medications you take, including paracetamol. This is important because paracetamol can interact with other medications, potentially causing harmful effects. Avoid drinking alcohol while taking paracetamol. Alcohol can increase the risk of liver damage when combined with paracetamol, so it's best to avoid it altogether during your treatment. By following these tips, you can minimize your risk of side effects and maximize the effectiveness of this common pain reliever. Remember, responsible use of paracetamol not only helps in managing pain, but also ensures your overall well-being. Always consult your healthcare provider if you have any questions or concerns about using paracetamol.
Section 11. Key takeaways. Using paracetamol. Safely and effectively. Paracetamol is a safe and effective pain reliever when used correctly. It is one of the most commonly used medications for pain relief and fever reduction. It can treat headaches, muscle aches, and fever. Many people rely on it to manage their symptoms and improve their quality of life. However, it is important to use it safely. Misuse or overuse can lead to serious health issues, including liver damage. Always follow the dosage instructions on the label. Never take more than the recommended dose, even if you feel that the medication is not working. Be aware of potential side effects. These can include nausea, rash, and in rare cases, more severe reactions. Avoid drinking alcohol while taking paracetamol. Alcohol can increase the risk of liver damage when combined with paracetamol. And tell your doctor about all the medications you take. This includes over-the-counter drugs, supplements, and herbal remedies. If you have any questions about paracetamol, talk to your doctor or pharmacist. They can help you understand how to use it safely and effectively. They can provide personalized advice based on your individual needs. Remember, your health and safety are paramount, so always seek professional guidance when in doubt.